So you're big on sedation in your practice. Like, what are the different levels of sedation and who chooses sedation?
Randy, that's a good point. Sedation is the foundation of our office. We have all levels of sedation. We have so many people who either are dental phobics or have anxiety about going to the office or have had bad experiences. They can come to the office and get laughing gas. They can come to the office and get laughing gas and a mild sedative. Or they can come and get oral sedation, or even better, the best is the IV sedation. Dr. Hall and I have both been trained in IV sedation, and we provide it to patients every day. And it's just a great option.
Like, you monitor what? Their like oxygen, their heart rate?
Yes, we do. We put them on a monitor that monitors, yes, their oxygen level, their heart rate.
Blood pressure must be lower if you're doing the sedation, right?
Yeah, in some cases, it's safer for patients to be sedated than to be worked on without any sedation due to their physical problems. Blood pressure being one of them. Typically, the blood pressure is lower while they're sedated, and we can do their work more safely.
So as a dentist, it must be much easier if somebody's somewhat sedated and relaxed to work on them.
It is.
Is that true?
It is. They're relaxed. We can get in there. We can get a lot more done at a single visit, and it's just a great option for patients who either, one, don't want to come back for multiple visits, or two, they don't, are afraid or anxious. They can come and get it all done at one visit and be done with it.
Now, I think you told me this, that some people are so afraid of the dentist, the night before you have to prescribe a pill just to get them to sleep.
Yeah,
is that true?
Yeah, part of the protocol is we will give them something to sleep the night before, and typically we'll give them something to take the morning before they get to our office. That way when they get there, they're feeling
relaxed.
Pretty relaxed.
Just need a ride, obviously.
Right, they have to have a ride, but so many people are so fearful they don't even like coming into the office. So we give them something to relax before they get there, and then once they get there, then we go ahead and complete the sedation.
Now, did you ever have any converts, people that were once afraid of the dentist and now they're okay with it?
It's quite remarkable, really, how many people who come in asking for sedation, and after they have good dental experiences, so many times they don't ever get sedated anymore.
They don't need it.
Yeah, they just realize that they can have dental treatment without any pain or discomfort.